All right, so today we're going to deep dive into women's cancers. We've got this Women's Cancer Awareness Guide we're working from, and I guess our mission is to help you guys feel empowered about your health.
Yeah, definitely informed and empowered. And
Yeah,
going a little bit beyond just the surface level.
I like that. So let's meet I guess, the usual suspects. We're talking about breast cancer, cervical cancer, ovarian, and endometrial cancers.
Yeah, those are some of the most common cancers that women face. And early detection is really key. With breast cancer, for instance, if you catch it early, the survival rates are so much better.
That's really empowering to know. How do we even know what to look for, though? This guide mentions all these warning signs for each type of cancer. Some are straightforward, like a new lump, but others, like bloating, seem kind of vague. How do you know if you should be worried?
Yeah, I mean, some of them are more obvious than others. That's why you really need to pay attention to what's normal for your body
Mm.
and notice anything that seems off. Take bloating, for example.
Mm.
If it's really persistent and doesn't go away with the usual remedies, then that could be a red flag, especially for ovarian cancer.
Okay, so just being in tune with your body is really key. The guide actually gets super specific about what a breast cancer lump can feel like. It describes it like feeling a small marble under the skin.
Right, and those descriptions can be helpful. It's all about becoming familiar with your own body.
Hmm.
Often these symptoms happen because the cancer disrupts your body's normal processes. For instance, cervical cancer might cause abnormal bleeding because the tumor messes with how the cervix normally works.
Gotcha. So we've talked about the warning signs. Now let's talk about early detection. The guide mentions mammograms and pap smears. Are those like the only tools we've got?
Those are definitely the big ones, especially for breast and cervical cancers. Mammograms are basically like special x-rays for your breasts. They can pick up on tiny abnormalities that you wouldn't be able to feel yourself. They usually recommend getting one every year starting at age 40. There's some debate about whether to start earlier, especially for women who have higher risk factors.
Right, so not just one size fits all. What about pap smears?
Pap smears check the health of your cervix. They look for signs of cervical cancer or precancerous changes, which are basically abnormal cells that could turn into cancer. The recommendation is to start getting them at 21 and then every 3 years after that.
And they usually do an HPV test at the same time, right?
Yeah, the human papillomavirus, or HPV, it's a really common infection, and it can lead to cervical cancer sometimes. So knowing your HPV status gives you an even better idea of your cervical health.
Okay, so mammograms, pap smears, and HPV testing are really important for early detection. But the guide also talks about building a shield through our lifestyle choices. What can we do to build that shield up?
Well, the cool thing is we actually have a lot of control over our cancer risk through the things we do every day. It's empowering to know that our choices can make a difference.
So tell me about these power moves.
First up is the food we eat. Think about vibrant, colorful plates full of fruits, vegetables, and whole grains. It's not about depriving yourself. It's about eating foods that nourish and protect your body. Studies have shown that a Mediterranean diet, which is high in olive oil and vegetables, can actually lower the risk of breast cancer coming back.
So swapping those chips for a salad is a good place to start. What else is on the checklist?
Regular exercise is another big one. Aim for at least 150 minutes of moderate intensity exercise every week. That could be things like brisk walking or cycling, or 75 minutes of vigorous activity like running or swimming. Strength training a couple of times a week is also really important. It can help lower your risk for certain cancers.
So moving our bodies and building strength. Got it. What about things we should avoid? The guide mentions smoking and alcohol.
Yeah, those are definitely big ones. Smoking and drinking too much alcohol are linked to a bunch of different cancers. Smoking is especially bad. It increases the risk of lung cancer, breast cancer, cervical cancer, and many others.
Right, so ditch the cigarettes and be mindful of the booze. Anything else we should be doing?
You might be surprised to hear that getting enough sleep is actually super important for cancer prevention. When you get good sleep, your body can repair itself and recharge, which helps keep your immune system strong.
So we've got a healthy diet, regular exercise, no smoking, being mindful of our drinking, and getting good sleep. It sounds like a recipe for good health in general. The guide also talks about self-checks. Can we unpack that a bit?
Of course, it's all about getting to know your body really well
Ah.
so that you can spot any changes that might be concerning.
You know, when I first started doing breast self-exams, I was so unsure of what I was feeling. I was like, is this a lump? Is this normal?
I think a lot of people feel that way at first. It takes time to get to know your body. And that's why regular self-exams are so important. They help you establish a baseline, so you're more likely to notice any changes that happen.
So how do you actually do a breast self-exam? What are we looking for?
Well, you want to use the pads of your fingers
Mm-hmm.
and make small circles all around your breast, from your collarbone to your rib cage and under your arm. You're feeling for any lumps, any thickening, or anything that just feels different. It's best to do it lying down, but you can even do it in the shower.
And about once a month.
You have about once a month, and if you have your period,
Mm-hmm.
aim for about a week after it starts. That's when your breasts are less likely to be tender.
So I have a question for everyone listening. When should you really sound the alarm and go to the doctor?
That's a really good question. If something feels off, don't ignore it. It's always better to be safe than sorry.
Like if the bloating just won't go away? Or if you have some pain that just doesn't feel right?
Right.
Or maybe some unexplained weight loss? Yeah.
Exactly. Any persistent symptoms or changes that just seem unusual for you
Hmm.
are worth getting checked out.
Hmm.
Your body often gives you hints long before something becomes serious. The key is to pay attention.
Trust your instincts. If something feels off, don't wait to see your doctor. They're your partner in this. And remember, it's always better to be safe than sorry. We've talked about a lot, but I want to make sure everyone knows that they're not alone in this. There's so much support out there.
Absolutely. We're actually going to talk more about those support resources in a minute. But before we do that, I want to tell you a quick story. I had a patient who was hesitant about doing self-exams at first, but she ended up finding a lump early on because she started doing them. And that experience really changed her perspective.
Yeah.
She became a huge advocate for self-checks in her community. It just shows how powerful knowledge and self-advocacy can be.
That's a powerful story. It really highlights how tuning into our bodies can make a difference. Speaking of support, we know that facing any health challenge, especially cancer, can be overwhelming. So let's talk more about those resources that can help people feel less alone and more empowered.
Absolutely. When we come back from the break, we'll explore the amazing network of support that's out there, from medical professionals to support groups and online communities.
We were talking about all that amazing support out there, like having a whole team in your corner, right?
Exactly. And it starts with your medical team. Your primary care doctor is a great place to start. They can answer your questions, run some tests, and refer you to specialists if you need them.
So, like, if you're concerned about cervical cancer, they might send you to a gynecologist. Or if there's a suspicion of cancer, you'd see an oncologist.
Exactly. And don't forget about genetic counselors. They're really helpful if you have a family history of cancer. They can help you understand your risk factors
Mhm.
and what you can do to manage them.
That makes sense. So we've got our medical professionals, but what about emotional support? Where can people go for that?
That's where those great community resources come in. There are tons of support groups, both in person and online. You can connect with people who really get what you're going through.
That must be so valuable to share experiences and know you're not alone.
Totally. It's really validating and reassuring. And it's not just about sharing. You can learn from each other, share tips and resources, and just feel less isolated.
The guide mentions online communities too. Are those like support groups?
Yeah, kinda. But online communities often have even more to offer. You can find educational materials, forums to ask questions and get advice from experts, and even connect with people from all over the world.
It's amazing how technology can bring people together like that.
It really has changed things. And it's not just online communities. A lot of hospitals and cancer centers offer workshops and programs. You can learn more about cancer prevention, treatment options, and coping skills.
So we've got support groups, online communities, and educational programs. What about individual support? The guide mentioned counseling too.
Yes, counseling can be so helpful, whether you're facing a diagnosis, making treatment decisions, or just feeling overwhelmed by it all.
It's important to remember that taking care of your mental and emotional health is just as important as taking care of your physical health.
Couldn't agree more. There are all sorts of mental health professionals who can help. Therapists, psychologists, psychiatrists, social workers.
So we've talked about building our team U. Let's do a quick recap.
Okay, so first we have our medical team, primary care doctor, specialists like gynecologists and oncologists, and maybe a genetic counselor.
Then our emotional support network. Support groups, online communities, educational programs, and counseling services.
Remember, you don't have to go through this alone. Reach out for help and build a team that supports you.
Okay, so we've talked about the common types of women's cancers, the warning signs, early detection, building our shield through lifestyle choices, self-checks, and building our support team.
It's been a really informative deep dive. But the main takeaway is that you have the power to be proactive about your health.
Before we wrap up, I want to leave you with one final thought. We talked about building a shield with healthy habits. What's one small change you can make today to strengthen yours?
Ooh, that's a good one. It could be something as simple as swapping that soda for water, adding more veggies to your dinner, taking a walk at lunch, or finally scheduling that mammogram.
Every little bit counts. Remember, knowledge is power. And by taking charge of your health, you're taking charge of your future. We talked about self-checks for breast cancer, but that idea applies to so much more.
You're right. It's all about paying attention to your body, your energy levels, your digestion, your menstrual cycle. Notice these little changes can help you catch things early on.
Like you're going from being a passenger to being the driver of your own health.
Exactly. And, while we've focused on cancer prevention today, a lot of these strategies are good for your overall health. Healthy diet, exercise, stress management.
It's like investing in your health.
Our bodies are so resilient, they can do amazing things with the right support. But we need to be active in the process.
So that brings us to the end of our deep dive into women's cancer awareness. We covered a lot of ground.
We did.
Understanding the types of cancer, the warning signs, early detection, and building a support network.
And most importantly, we talked about how important it is to take charge of your health. Be proactive and advocate for yourself.
We hope this deep dive has been helpful and empowering. Remember, you're not alone. There are resources, people who care, and a whole community ready to support you.
So go out there, be your own health advocates, and live your lives to the fullest.
Until next time. It's like we have this owner's manual for our bodies, but we have to actually read it, right?
Yeah, we have to take the time to understand it.
We've been talking a lot about cancer prevention, but a lot of these strategies are just good for your health in general.
Oh, absolutely.
Yeah.
Eating well, staying active, managing stress, getting enough sleep. Those are all important for preventing all sorts of chronic diseases.
It's like a win-win.
Definitely.
It's amazing to me, even small changes, if you do them consistently.
Yeah, it all adds up. It's not about being perfect. It's about making those changes that you can stick with.
So we've come to the end of our deep dive on women's cancer awareness. We've learned about the different types of cancer, the warning signs, early detection, and how to build a support system.
And we learned that knowledge is power. When you're